are going to get started now. Good evening, everybody. I'm Russ Silbergley, the chairman of the board of directors of Jewish Federation of Delaware. Thank you very much for joining us tonight. We are so thrilled to bring you the results of the first study of the Delaware Jewish community since 1995. Now, to put it in perspective, when I say 1995, that's the year personally that I started working in Delaware and that Michelle and I got married. So it's been a little while since we've done this, and more apropos to a community study, just think about how different Delaware itself is, not just the Jewish community. We're talking about a moment in time where DuPont, MBNA, and so many others had a very different footprint than they do today. So Federation undertook to do a comprehensive study of our community so that we can have real data in our ability to plan for the future. From the outset, this was all about getting information, not for ourselves, for Federation, but for our synagogues and agencies. And that's what we're here for. Only a Federation really has the ability to do that for the benefit of our community, and we are stronger together. So this is the culmination of nearly 18 months of really intense efforts. And I want to personally thank Leslie Newman and Richard Levine, who have been the co-chairs of this committee and worked tirelessly on this, as well as all of our committee members, as well as Seth and Hillary for all of their hard work in getting us to this point. It's been a lot of work. And with that, I would love to turn it over to Leslie Newman. Thank you.
Good evening. On behalf of my co-chair, Richard Levine, and me, thank you for joining us this evening. As Russ just told you, the last time we completed a demographic study was 1995. It focused on the northern part of our state and did not include the Brandywine Valley. Surveying techniques have changed since then, and so has our community. We began this process in the fall of 2021 by establishing a committee that reflected the diversity of the areas we would be surveying, the entire state of Delaware and the Brandywine Valley to our north. Members included Susan Aronson, Rabbi Michael Beals, Paul Fine, Jen Goldstein, Danny Haas, Jack Jacobs, Arlene Johnson, Robin Carol Eng, Cindy Konowitz, Jesse Miller, Gina Schoenberg, and Bill Wagner. We thank them, as well as Seth Katzen and Hillary Stiebel from the Jewish Federation of Delaware, for their support and hard work. Our next step was to meet with the lay and professional leadership of Delaware agencies, synagogues, and service organizations. These meetings guided the development of the survey instrument. Surveying took place between February and May of 2022. Our goal was 750 respondents. We were so pleased that we exceeded that goal. Matt Boxer, who you will hear from in a few minutes, was the chief investigator. Tonight's an opportunity for us to learn as a community. This presentation is being recorded for those who could not attend. We ask that if you have questions, that you post them in the Q&A section on your screen. They will be addressed as time permits after Matt's presentation. But tonight is the first step in sharing the results with our community. Brandeis will also be holding a series of smaller sessions with targeted groups such as human service organizations, synagogues, and specific geographic regions. The Jewish Federation will then be providing resources to our agencies, synagogues, and organizations to assist them in strategic planning using this data. To that end, a new committee is being formed to shape those next steps. It will be led by Jen Goldstein and Jack Blumenfeld. The full report, executive summary, and technical appendices will be posted on the Federation website tomorrow, along with this recording. The data files will be available in about a month. Now I would like to introduce Dr. Matt Boxer. Matt is an assistant research associate. Matt is an assistant research professor in the Maurice and Marilyn Cohen Center for Modern Jewish Studies at Brandeis University, which is home to the Steinhardt Social Research Institute. That's a mouthful. They have completed more than 25 similar studies around the country. Matt's expertise is in small and intermediate communities, just like us. At this point, Matt, it's your turn.
Thank you very much, Leslie. I'll share my screen, or got to make sure I select the right one. There we go. So with any luck, you should all be able to see my screen now. And I'm very pleased to be with you tonight to discuss with you the findings of your community study. Jewish communities in the United States have been sponsoring studies like this for nearly 100 years, but they're part of an even longer tradition for the Jewish people. The Torah portion from a couple of weeks ago is a pretty good illustration of this. It started out, Ve'ele shmot bnei Yisrael habaim Mitzrayma. These are the names of the sons of Israel who came to Egypt. I'm translating that as sons because only the sons were specifically named. And a couple of verses later, Vayehi kol nefesh yotzei Yarach Yaakov shivim nafesh b'Yosef haya b'Mitzrayim. And these were all the souls descended from Jacob, 70 souls, and Joseph was already in Egypt. 70 souls counted 3,500 something years ago, but without asking about ritual practices or affiliations, activities, children's Jewish education, it made for something of a rudimentary community study. Of course, it was a lot easier to account for the full community back then. It's a lot more difficult today. In fact, I always tell people that of all the different kinds of research being done in Jewish communities today, a comprehensive Jewish community study is the most difficult to do well, but the challenge is part of what makes the work fun. My team has enjoyed working on this study, and as it always is, it's a real pleasure to be with you tonight to share some of the highlights. You should know that what I'm sharing with you tonight really is just the tip of the iceberg. The full report, which, as Leslie mentioned, will be available on the Federation website in the morning, is over 100 pages, and it's accompanied by a couple hundred pages of technical appendices, which again will also be available to you. The appendices describe in excruciating detail exactly how we conducted the research and also provide some useful tools like comparison charts that break down nearly every question on the survey by some key population segments, a code book that lists every question on the survey and shows how many people gave each response, and a few maps that do not appear in the main report. And also, as Leslie mentioned, in about a month, for anyone who is adept at data analysis, there will be a public use version of the data set that will also be made available. So as you'll see in the slides that I'm presenting tonight, and as you read through the report and the appendices, there are a few questions that you should consider. First, is there anything that surprises you in the findings? Did we find a population that you didn't know was there? Did we uncover a need that you didn't know existed within your community? Or are you doing better in some respects than you thought you were? To what extent did we confirm what you already thought was true about your community? How can you use these findings to serve your community? Are there any segments of the population that you think require your attention or needs that you think you can address with these data? And is there anything else that you want to know? As I've said, there simply isn't enough time to present all of the findings in a PowerPoint presentation, and the report is very, very rich, but there are some things that you just can't do in a survey that may require additional research, whether the kind that we do at the Cohen Center or the kind that you can do on your own without us. We'll help you as we can, but in a very important way. Now that the hard work of conducting the study is over, it's time for us to pass the proverbial baton to you for the really hard part of figuring out how best to use the findings to serve your community. Now, one final note before I start sharing the findings. one of the challenges in conducting a community study is determining exactly what geography to cover. This study is sponsored, obviously, by the Jewish Federation of Delaware, and so one might assume that it covers the entire state of Delaware, and that's it. And we did cover the entire state of Delaware, but for your previous studies, that was it. But it was clear from the beginning of this study that the service area for the Jewish Federation now also includes some part of the Brandywine Valley in Pennsylvania. Exactly how much of it? That's a difficult question to answer. And so at the beginning of the process, I sat down with the study co-chairs and Federation staff, and we looked at a map and we decided on which zip codes to include. For the most part, I think the decisions we made look pretty good in retrospect, but we did find that proximity to Philadelphia meant that we had a fair number of households that we surveyed who are active in the Jewish community there and not necessarily in Delaware or the part of the Brandywine Valley that we were treating as the service area of the Jewish Federation of Delaware. Knowing what we know now, we may not have included a small number of the zip codes that were covered in the study, and that would have had a small effect on some of the estimates. The total population estimate would have been a little bit smaller. The distribution of the population would have shown a slightly smaller proportion of the total population in the Brandywine Valley, and there probably would have been some small effects on other factors as well. At the end of the day, none of these changes would have substantially changed any part of the story in the data. The reality is that you can draw the boundaries between Jewish Federation service areas any way you like, but these are not international borders between warring states. The people living on one side of the border may choose to participate in Jewish life on the other side of the border, and that's okay. For those of us who want to promote engagement in Jewish life in all of its many manifestations, the most important thing is that people are doing Jewish things, not necessarily where they're doing them. If you want them to join your organizations and participate in your programs, then yes, where they do Jewish things matters, but you'll have an easier time of attracting them if they're already interested in participating in Jewish activities. In any case, just something to keep in the back of your minds as you go through all the material from the study. So enough caveats. I know you want to look at some of the findings. Let's start doing that now. Let's start with the size of the community. We estimate that there are nearly 26,000 Jewish individuals living in Delaware or the Brandywine Valley in about 12,600 households. These Jewish households also include about 6,000 non-Jewish adults and 2,100 non-Jewish children. Now, those additional 8,100 people do not consider themselves Jewish, or they are not considered by their parents, in the case of the children, to be Jewish, but they're still part of the Jewish community because they're part of Jewish households and Jewish families. And the tricky thing about the kids in particular, both those whose parents consider them Jewish and those whose parents say they're not, is that eventually they'll grow up and have the agency to make their own decisions about their identities. We don't know which kids whose parents don't consider them to be Jewish will go off to college, meet friends who will drag them along to Shabbat dinner at Hillel or Chabad, sign up for a birthright trip, discover how wonderful it can be to be Jewish, and choose that part of their heritage as a salient personal identity. And we don't know who among the children whose parents say they're Jewish will grow up and decide that that's not an identity they want to keep. I'll have a bit more to say about these kids in a few slides, but for now, let's take a look at where do these 12,600 Jewish households reside within your community. That's what this map shows us. We've made the map as large as we can in the slide, but it still may be a little difficult for you to discern any details on the screen. So I recommend that you look at the larger version on page 23 of the report or page 216 of the technical appendices when you have a chance. For now, let me just tell you a little bit about what you're looking at here. This is what we call a dot density map, and it's a way to represent the distribution of Jewish households across your community. Each red dot that you see on the map represents 25 Jewish households, and each dot is randomly placed within the zip codes where those households reside. We've divided the map into 5 regions, and you can see there is very heavy concentration of Jewish households in Wilmington, and that's that yellow area in the northeast corner. Parts of the Brandywine Valley, the light blue area just above it. A little bit less concentration in part of the Newark area, that's the light green in the upper left. And in one specific part of Sussex County, that's the orange on the bottom. And you'll see a smattering across the rest of the map. Not shown in the table, about 1/3 of the children in your community live in the Brandywine Valley, and about 1/4 in Sussex County. Now, notably, your last community study in 1995 estimated that nearly 90% of the Jews of Delaware resided in Newcastle County, mainly in the Wilmington area. That study, as Leslie mentioned, did not include the Brandywine Valley, but even without it, it's clear that the community is far less concentrated than it used to be, with Sussex County a particular locus of growth. Now, one final note on the map. If you see a spot where you know there's a Jewish family or two, but you don't see a dot, that's not a mistake. That might mean that there weren't enough households in the zip code to meet our threshold for displaying them, which can be a security issue. If there's only one Jewish household in a particular zip code and we show them on the map, they're very easy to identify. And we take very seriously our duty to protect the identities of the people who completed the survey. The other possibility is that it's simply an artifact of this being a survey and not a census. In a census, you can enumerate every single individual and household in the community, and just as I described from Parshat Shemot at the beginning of this presentation. But of the approximately 12,600 Jewish households in Delaware and the Brandywine Valley, we only collected data from 1,065 of them. So it's possible that the family you know isn't represented on the map because they didn't take the survey. Having no respondents in a particular zip code or any other category in the survey does not necessarily mean that no one fits that description or belongs to that category. It just means that there aren't very many people or households in the community overall who do. And if you're worried about how accurate the results of the study can be, if we only collected data from roughly 1 in 12 Jewish households across the entire community, random sampling is an amazing mathematical tool that makes this possible. If you think of it like a pot of soup, if you use the right mix of ingredients and you combine them and cook them the right way, you don't actually need to consume the entire pot to know that it tastes good. You only need a small sample, like a bowl of soup. Some bowls might have more chunks of carrot and others fluffier or denser matzo balls, but in a well-made pot of soup, each bowl may be a little bit different, but will still be a good and accurate representation of the whole pot. For a study like this, we use math to draw a sample of the population that accurately reflects the overall population, much in the same way that a bowl of soup will be an accurate representation of a well-made pot of soup. The key there is really the well-made portion. So moving along, here we've compared the ages of Jewish adults in Delaware and the Brandywine Valley to the overall population of the region and also to US Jewish adults. In fact, you'll see throughout the report where there are comparable data for the US Jewish population as a whole, typically from the 2020 Pew study, we've provided the comparison. The US Jewish population skews a fair bit older than the overall national population, and that's a pattern that holds true in most local communities as well, including yours. In fact, your community even skews a little bit older than the US Jewish population as a whole, though you have a slightly lower proportion of your population that is 75 or older. You have more people in the 65 to 74 range. Now, of the 5,600 children who reside in Jewish households in Delaware and the Brandywine Valley, parents told us that 3,500 of them are being raised Jewish in some way, and 2,100 are not. Most of the non-Jewish and unknown children, there are a couple hundred whose religion is yet to be determined, or parents haven't decided yet. Most of those children are being raised in no religion by interfaith families. More on this in the next couple of slides. A small number of them are being raised in another religion, and we probably underestimated the exact number by a little bit, but the relative proportion is probably about right. There are also a couple hundred kids, as I said, whose parents just haven't decided how to raise their kids yet, or who chose not to say how they're raising their kids. And I'll be saying more about them as well over the next couple of slides. Here we see that in your community, 71% of Jewish households include a married or partnered household. The couple intermarriage rate is 56%, meaning that of these married or partnered households, just over half include one Jewish and one non-Jewish spouse, and that's pretty close to the national average. Of the children who are being raised Jewish in any way, about half are being raised by intermarried parents, which highlights the importance of engaging with intermarried couples. So how well are you doing in that regard? A good proxy measure is the proportion of children of intermarried couples who are being raised Jewish, and we're going to see that on the next slide. Now, both nationally and in Delaware and the Brandywine Valley, it's just about universal that in married couples, couples with two Jewish partners, are raising their kids Jewish in some way. Here we see that 91% of the children of two Jewish parents are being raised exclusively Jewish, and 8% are being raised in no religion. If that doesn't quite add up to 100, it's just because of rounding issues. Now, there might be some blended families outside of the 91%, and the no religion folks likely include some people who simply haven't enrolled their kids in Jewish education yet, and would tell us that their kids are Jewish if they were just a year or two older. But it's nearly universal that in households with two Jewish parents, the kids are being raised Jewish in some way. It's a little bit different for children raised in intermarried households, both nationally and in Delaware and the Brandywine Valley. In your community, of all children in Jewish households whose parents are intermarried, 67%, 2/3, are being raised Jewish in some way, and that is almost exactly the same as the national average. What that tells us is that you're doing a pretty good job overall on including intermarried couples and their families, because 20 years ago, this number was closer to 25%, 1 in 4 nationally. But here's what I want you to take away from all of this. As I've already noted, we don't know which children are going to grow up to embrace their Jewish identities and which to reject them. But the single best predictor of who will choose to be Jewish in adulthood is the same, regardless of whether we're talking about people with two Jewish parents or one Jewish parent. It's who is engaged in high-quality Jewish programming, broadly defined in childhood, including Jewish schools and preschools, camps, youth groups, programs like PJ Library, and so on. So I won't be sharing tonight a slide about how many are currently participating in such programs, but there is a wealth of information in Chapter 4 of the report. Suffice it to say that the more that you can do to make these programs accessible to families throughout your community, the more the Jewish community will benefit in the future. It really is an investment in the future. Turning to synagogues, we see that 31%, nearly 1 in 3 of Jewish households in your community say that they belong to a synagogue, temple, independent minyan, chavurah, or high holiday congregation, which is again comparable to the national average. But of your members, only about half pay dues to a synagogue in your community. Nearly 1/3 of synagogue members belong to a synagogue that is outside of the area that we surveyed. Some of these are seasonal residents who maintain synagogue membership in the other communities where they reside for part of the year. And some of these are people who live in the Brandywine Valley, roughly equidistant between Wilmington and Philadelphia, who have chosen to belong to a congregation outside of the area covered in this survey. Many of this latter category are people who live in the zip codes that we might not have included if we knew at the start of this study what we know today. As I've noted, the thing to remember here is that although studies like this have to address somewhat rigidly defined geographic boundaries, the people who live within those boundaries are only restricted from participating in Jewish life in adjacent communities by their own interest, willingness to commute, and any resources necessary to participate. And as wonderful as your community is, there are simply more options available in Philadelphia for those willing to make the drive, and particularly for those for whom the drive is, it's no different from coming into Delaware. Also worth noting here, the data were collected during the pandemic, and so attendance at services and participation in various kinds of activities were likely artificially depressed a little bit by COVID. Synagogues and other Jewish organizations did an outstanding job of pivoting to online programming in 2020 and 2021, but Zoom services are not an option for everyone. There was a balance between the needs of public health and religious participation, and by 2022, people were just ready to be back in person as much as possible. Still, our sense of conditions from a series of studies that we conducted in 2020 about the experience of COVID and all of the communities that we've conducted during the pandemic is that the numbers we're getting are likely pretty close to what they would have been if there had been no pandemic. And that's a real tribute to the efforts of all of the people who make our Jewish organizations work. Now, in terms of denomination, on the whole, you can see that although the denominational distribution of the local Jewish population is somewhat different from the national estimates, the relative sizes of groups are pretty similar. The Jewish community of Delaware and the Brandywine Valley is part of the leading edge of a move away from denominational affiliation for American Jews. In your community, the largest denominational category, representing 43% of Jewish adults, is no denomination. Among those who do identify with a particular denomination, the largest group is Reform, followed next by Conservative. There are also smaller numbers who identify as Reconstructionist, Traditional, Orthodox, or with other denominations. But one of the clear findings from the last 20 years of research on the United States Jewish community is that denomination is becoming less and less valuable as a category for analysis. It used to be that each one of these labels was highly predictive of a range of ritual behaviors, affiliations with Jewish organizations, and participation in other kinds of Jewish activities. Today, they're still useful, but where you used to know, for example, that someone who said that they had no particular denomination probably wasn't going to be very engaged in Jewish life, that is no longer necessarily true. With this trend in mind, about 8 years ago, the Cohen Center developed a tool that we use to describe more accurately the patterns of behavior that exist throughout a Jewish community. We call this tool the Index of Jewish Engagement, and when we apply it to the Jewish community of Delaware and the Brandywine Valley, we find that there are 4 predominant patterns of behavior that I'll describe in a moment. Now, this breakdown is unique to your community. Other communities have their own patterns of behavior. It was created out of analysis of 18 specific behavioral items from the survey that reflect different kinds of Jewish behavior, both religious and cultural items, both activities that you engage in through organizations, and those that you can do on your own or with close family or friends outside the auspices of Jewish organizations. And I always like to emphasize that this breakdown is not intended to pass judgment. We're not judging how anyone lives their Jewish lives. We're only trying to describe how people in your community live their Jewish lives. So using a mathematical tool that's called latent class analysis, We analyzed these 18 specific behavioral items that I'll show you in a few minutes. And we determined, as I said, that there were 4 predominant patterns of Jewish engagement in your community. If you're thinking about how to engage with different kinds of people, you'll note that you may need different strategies for each group. So what do these groups look like? Our first category, representing 38% of Jewish adults in Delaware and the Brandywine Valley, we call the minimally involved group. These folks do some Jewish activities on their own, but they have little to nothing to do with Jewish organizations, and so they're easy to overlook. You might not know many of them. You probably know some of them. You might even know some of them personally, but they are truly largely off the radar of Jewish organizations. In general, there isn't a whole lot that you can do to reach out to them. All you can do is offer high-quality programming and hope that they'll know that they can come to you if and when they decide that they want to get more involved in Jewish communal life. The second group, which we call the holiday group, represents 24% of Jewish adults in your community. They may show up occasionally in Jewish communal spaces, and most of them are members of synagogues, though they don't attend services or participate in activities very often. Their defining characteristics are that they are very supportive of synagogues, even if they don't attend very often, and they are particularly interested in celebrating Jewish holidays. That's what it means to them to be Jewish. And so your best way to reach them is by having high-quality programming around Jewish holidays. The third group, which we call the personal group, represents 19% of Jewish adults in your community. I would not say that they are more or less engaged in Jewish life than the holiday group, but their engagement looks a little bit different. They're less likely to join synagogues, and they tend to score a bit lower on most measures of ritual behavior, but they participate in other kinds of activities with greater frequency, both under the auspices of Jewish organizations and on their own. The people in this group tend to want a little bit of everything in Jewish life, but it's not necessarily such a high priority that they engage all the time. Finally, we have the immersed group, which is 19% of Jewish adults. These are the folks that you probably know best. They're highly involved in most elements of Jewish life, both the ones that you do on your own and the ones that you do through or with Jewish organizations. They tend to be the backbone of Jewish organizations. Judaism, whether religious, cultural, or social in nature, is a defining characteristic of their lives. Here you see the breakdown of the 18 variables used to create the index across the 4 engagement groups. And you can see that we've broken down these behaviors into 4 categories: holiday behaviors, ritual behaviors, organization behaviors, and individual behaviors. The differences between these categories are sometimes subtle, sometimes stark, but collectively they represent 4 different realms of contemporary Jewish behavior. The darker the shading of a cell, the greater the proportion of people in the engagement group represented in a selected column who participate in the activity in a given row. So you can see the shading is very light across most items for the minimally involved group, pretty dark on most items for the immersed group, and lighter on some items but darker on others for the holiday and the personal groups. And if this table is a little bit difficult for you to read on your screen right now, it appears in larger print on page 30 of the report. Now, we're frequently asked if engagement group is just a substitute for denomination, if the immersed group is really just a substitute for Orthodox, minimally involved, for no particular denomination, and the other groups somewhere in between. There's certainly a significant overlap, and the gray shading that you see in this table means that there is a statistically significant difference in the denominational affiliations of members of different engagement groups. More specifically, for example, there's a clear relationship between being Orthodox and being immersed. Nearly all Jewish adults in your community who identify as Orthodox are in the immersed group, while other denominations are more widely distributed across the engagement groups. Though it's also worth noting that there are some Orthodox Jews in both the personal and the holiday groups as well. There's also a lot of overlap between the denominational nuns and the minimally involved group. 72% of the Jewish adults in the minimally involved group say they identify with no particular denomination. But there are also people who identify with no particular denomination in each of the other engagement groups as well, and they even make up 9% of the immersed group. And there are conservative and Reform Jews and adherents of other denominations in every single engagement group as well. This is the real value of a measure like the Index of Jewish Engagement. Traditionally, Jewish populations have been assessed in studies like this by their demographic characteristics like age, or in-married versus intermarried versus not married, or by what they call themselves, like denomination. And we've relied on stereotypes to assess behavior. Older folks are deeply engaged while younger folks are disengaged. In-married couples are deeply involved in the Jewish community, while intermarried couples tend to stay away. The Orthodox are deeply engaged and the just Jewish are not. And there's a kernel of truth in some of these stereotypes, while others are completely false and even harmful to the Jewish community. So rather than rely on these outdated modalities, we use this index that is based on what Jewish people are doing rather than what they call themselves or the demographic groups to which they belong. So here you see an example of how we use them throughout the report. Similar to what we saw on the last slide, the shading here represents that there are statistically significant differences between engagement groups and frequency of participation in Jewish programs. Now, there's nothing surprising about finding that 74% of people in the minimally involved group never participate in programs, or that 49% of people in the immersed group participate often. These differences are exactly what you'd expect for groups that are defined by how often they engage in Jewish activities. But we break down just about everything by engagement group, and you may find that the differences you see between engagement groups throughout the report might suggest some new ideas for how to engage members of your community, or for addressing obstacles that some of them may have to greater participation in the community. Turning now to philanthropy, we found that nearly 2/3 of Jewish households in Delaware and the Brandywine Valley made charitable donations to Jewish organizations in the past year. Nearly all of these also gave to non-Jewish organizations, but there is a small group who donated exclusively to Jewish organizations. There were another 17% of households who donated only to non-Jewish organizations, and 21% either made no donations or could not recall if they had. 8% of Jewish households donated to the Jewish Federation of Delaware. And if that sounds low to you, you should know it's actually not that unusual. To the extent that community studies tend to report higher estimates, it's often because there's a flaw in the methodology that does not correct properly for highly involved households being more willing to participate in a survey about Jewish life. In our design, we have multiple techniques built in to correct for that problem, so we know our estimate is more accurate, and most importantly, the number that it would represent matches up very closely to the number of donors that Federation tells us they had. So we know that this isn't an unusually low number, but we can also see some potential for increasing the numbers based on some geographic realities. On page 68 of the report, you'll be able to see that the proportion of households that donated to the Jewish Federation in the past year varied by geographic region, from a high of 16% of Jewish households in the Wilmington area, the historic core of the Delaware Jewish community and where Federation is based, to lows of 2% of Jewish households in Sussex County and 5% in the Brandywine Valley. Now, we did not ask why households did or did not donate, but based on the totality of evidence, we can make some reasonable assumptions. Sussex County, for instance, has historically not had a very large Jewish population, and many of the Jews who resided there were seasonal residents who may have made donations to the Jewish federations and the other communities where they live for part of the year. They may not have given much thought to the Jewish Federation of Delaware, and because the federation is based in Wilmington, the distance meant that federation didn't really pay all that much attention to them either. In the last 28 years since your last study, it's clear that the population has shifted a bit, and so have attitudes towards Sussex County. There's still plenty of seasonal residents there, but there are now more year-round residents as well. Some of them moved from the northern part of the state. Others may have been seasonal residents who decided to live permanently in Sussex County, and the Federation is now paying more attention to them than it did in the past, but it takes many years to build the kind of relationship that attracts a lot of donors. Similarly, even accounting for the apparent draw of Philadelphia for some of the households in the Brandywine Valley, this is still a segment of your community that historically has not gotten much attention from the Jewish Federation of Delaware, and that is starting to change. If you continue giving them the attention that they need, those numbers are likely to come up a little bit. Now, not shown in this slide, we also have data on volunteering. 43% of Jewish adults said that they'd volunteered anywhere in the past month, including 20% who volunteered for Jewish organizations and 27% who volunteered for non-Jewish organizations. Those numbers don't quite add up because a fair number of people volunteered for both Jewish and non-Jewish organizations. Here you see a little bit of information about how connected Jewish adults in Delaware and the Brandywine Valley feel to the Jewish people in general, the local Jewish community in particular, and to any sort of online Jewish community. I like to think of feeling a sense of belonging to the Jewish people as being an abstract sense of connection, while connection to the local Jewish community is a more concrete indicator of finding one's place in the Jewish community where they live. The observed difference that only 7% of Jewish adults in your community feel no sense of belonging to the Jewish people, but 38% feel no sense of belonging to the local Jewish community is a pretty good proxy for how many people in your community might be looking for a greater sense of connection if you can figure out precisely what they're looking for. Now, that also might seem like a big difference, but it's pretty average for what we've seen across the dozens of community studies that we've conducted. Now, we have not always asked about connection to an online Jewish community. That's a relatively new innovation for us, and we've been using it as something of a COVID adaptation. I think the fact that about half of the community feels a connection to an online Jewish community and half feels no such connection is both a commentary on how important it is for the Jewish community to be able to meet face-to-face for our various activities, and a mark of how hard we all have to work to build and maintain community when it was not safe for us to be together. But even as much of the world is returning to something resembling a pre-pandemic normal, it is important to remember that there are still members of your community who remain at high risk for COVID. For their sake in particular, though not solely for them, it is important to continue offering virtual programs and building your online Jewish communities. We also asked about connection to Israel, visits to Israel, and following news about Israel. In your community, 70% of Jewish adults say they feel somewhat or very attached to Israel, and 47% have visited at least once. Both of those figures are comparable to the national average. 9% say they follow news about Israel very closely, and another 44% somewhat closely. Turning to anti-Semitism, this is a topic that is always worth mentioning, but usually not worth dwelling upon too much. We asked respondents to assess their level of concern about anti-Semitism around the world, in the United States and in Delaware or the Brandywine Valley. And similar to our questions about a sense of belonging to the Jewish community, we can look at these items as ranging from abstract to concrete concern. Around the world is very abstract, in the US is more concrete, and in the community where you live is something that could affect you on a day-to-day basis. So it's not surprising to find that the greatest concern expressed about anti-Semitism is around the world. A more moderate level of concern is expressed about anti-Semitism in the United States, and a lower level of concern, though still a fair amount, is in Delaware and the Brandywine Valley. Where the table is shaded, it indicates that there are statistically significant differences between geographic regions, so there is greater concern about anti-Semitism locally among Jewish adults in Sussex County and Wilmington, and somewhat less concern in the Brandywine Valley, Newark, and the rest of Newcastle and Kent counties. Now, the greater concern in Sussex County is partly explained by a much higher proportion of Jewish adults who have personally experienced an anti-Semitic incident in the past year. Overall, 18% of Jewish adults in Delaware and the Brandywine Valley said that they had personally experienced an anti-Semitic incident in the past year, compared to 27% in Sussex County. If the 18% figure sounds high to you, don't worry about it too much. It's really about average. That doesn't mean that it's acceptable. We shouldn't have to tolerate any incidents. But in the standard lecture on anti-Semitism that I used to give to my graduate students, I would describe this sort of baseline level of anti-Semitism as the price you pay for being a minority in the United States of America. It's not okay, but it is a reality of the world that we live in, where Jews are simultaneously both the best loved and most hated religious group in the country. The promise expressed by our first president, George Washington, borrowing from his correspondence from the Jewish community of Newport, Rhode Island, that the United States to bigotry gives no sanction, to persecution no assistance, but generously affording to all liberty of conscience and immunities of citizenship, has always been aspirational. And clearly, there is still plenty of work to do. Turning now to some financial issues, we spent a great deal of time on the survey measuring economic well-being. Yours is a relatively affluent community, as most Jewish communities in the United States are, with only 1% of Jewish households in Delaware or the Brandywine Valley having household incomes below the federal poverty line and 10% below 250% of it. True poverty is rare in your Jewish community, but it is not non-existent. And economic vulnerability is pretty common. In the report, we combined the lowest two categories on the standard of living question, those who described their standard of living as either being unable to make ends meet or just managing to do so, into a category that we call struggling. This category includes 15% of Jewish households in your region. It's likely that this number would be a little bit lower absent the pandemic, but not much lower. We found in some of our research that households that were doing okay financially before the pandemic tended to be doing okay during it, or even pretty well. It's really the folks who were struggling before who are struggling now, in many cases in worse condition, plus a few folks who were sort of at a tipping point, who were okay before the pandemic, but now aren't. And the next slide will share a little bit about how those struggles play out. So we asked a series of questions about financial hardships and insecurity. We found that in the past year, 8% of Jewish households in Delaware and the Brandywine Valley experienced any of the financial hardships that we asked about. Paying for healthcare, utility bills, rent or mortgage, or food. And you can see the breakdown on the table on the left. It doesn't all add up neatly to 8% because, as you might expect, a fair number of households that struggle with one of these items also struggle with others. For those who did not experience any of these hardships in the past year, We also asked if they may have experienced them between 1 and 3 years ago, and an additional 5% said they had. These numbers are probably all slight underestimates because there's a stigma attached to economic vulnerability, but they're probably reasonably close. And in addition to the hardship data, we also found that 2% of Jewish households are unable to pay an emergency $400 expense with cash on hand or a credit card they can pay off completely at the end of the month. The bad news is that that's 2% more than you would like to see. The good news is that nationally, according to the Federal Reserve, as of 2021, about 1 in 3 households in the United States could not afford such an expense. And when you think about that $400 emergency expense, it's a flat tire. It's a fraction of the cost of a dental emergency. For some people, even with insurance, it's the copay for a visit to the emergency room. This is a measure of desperation. And it's important to recognize that although most of the Jewish community is not economically desperate, there are some members of the community who are desperate and could really use a little bit of help. And this is not only about desperation. About 1 in 7 households, Jewish households in your community, are not at all or not too confident that they'll be able to keep their current savings or investments. A similar proportion said that they limited their involvement in Jewish life for financial reasons. A fair number of parents required financial assistance to be able to afford to enroll their children in Jewish schools or to send them to Jewish camps and other activities, but another 6% didn't enroll their children at all for financial reasons. 7% of synagogue member households needed financial assistance to maintain their memberships, and another 5% discontinued their memberships altogether for financial reasons. 3% of Jewish adults were concerned about affording health care, and 8% of those 55 and up were worried about being able to afford to retire or to live comfortably through their retirement years. So again, yours is a relatively affluent community, but there are still many households that are struggling financially. Now, financial struggles are often related to health issues, and we have quite a bit of data on those as well. In the Jewish community of Delaware and the Brandywine Valley, we estimate that 19% of all households include at least one person who is limited in their work, school, or activities by some sort of health issue, special need, or disability. And in this table, you can see that we've broken that down on the right into the proportion of all Jewish households that include someone with a particular health issue. And in the middle column, the proportion of all households that include someone with a health issue where that particular issue is the one in question. So as you can see, chronic illness is the limiting health issue in a little over half of all households where anyone has such an issue. And those households represent 10% of all Jewish adults in the community. You can also see that by far, the next most common health issues are physical disabilities and mental or emotional health issues, which have skyrocketed across the board during the pandemic. In general, as you might expect, older Jewish adults have significantly higher rates of health issues, special needs, and disabilities, but there are health issues across the age spectrum. Notably, very few households said they included someone who was suffering from COVID-19 complications. However, 25% of Jewish adults said that COVID was a significant barrier to participating in Jewish life. So most people had been able to avoid COVID or at least long-term consequences from it up to and even through much of the wave that washed over us last spring when we were collecting the data. But it was still a big barrier, and it will continue to be so, particularly for people at high risk for quite a while longer, which is, after all, one of the reasons this gathering is over Zoom rather than in person. Now, I've spent a lot of time talking to you, taking you through some of the basic findings from the study. These, together with everything else we wrote about in our nearly 120-page report, led to a series of general recommendations for your community that I'll discuss briefly to conclude tonight's presentation. But before I get to these specific items, there are 2 other I would like to mention. First, you may have noticed in several places throughout the presentation, I mentioned that your community's numbers look pretty similar to national level estimates. It was striking to us as we looked through the data just how similar the overall profile of the Delaware and Brandywine Valley Jewish community looked to the national profile of US Jewry. But we also thought it was a little misleading because of the second issue that I want to raise. I started this presentation by talking about how challenging it is to conduct a Jewish community study, but typically these are studies of a Jewish community. Yours is not a single Jewish community. It's more of a loose confederation of a handful of smaller communities, each with its own distinct culture that makes it different from the others. Any one Jewish community may differ from the average, but obviously, when you add all communities together, there's going to be an average. And it's a well-known law of statistics that when you add together lots of smaller groups, they eventually converge around the average for the larger population. It's usually not quite as good a fit so quickly as what we've seen in Delaware to compare to the national population, but it's still a universal truth. What that means is that where we're describing what we're calling the Delaware and Brandywine Valley Jewish community, what we're really describing is a combination of several communities. If what I've described to you over the course of this presentation, or when you pick up the report, doesn't seem like it's a great reflection of the segment of the community that you live in or where you spend most of your time in Jewish spaces, it's probably because there isn't a single Jewish community of Delaware and the Brandywine Valley, but rather several Jewish communities of Delaware and the Brandywine Valley. These recommendations may apply more in one location and less in another, and precisely how you go about implementing them may need to be a little bit different from one location to another. Implementation really depends on hyper-local factors, which is why we write them pretty generally. So without further ado, our recommendations. First, promote active ties and innovation across the multiple Jewish communities of Delaware and the Brandywine Valley. The great advantage of being a loose confederation of multiple communities is that you have more settings in which to try new things and more confederates that you can convene together easily to learn from each other. Taking active steps to intentionally bring together leaders of Jewish organizations from across your multiple communities to share what they know and what they're trying to deepen engagement in their communities and to reach out to the less engaged folks in your communities and to learn from each other is likely to multiply benefits across all of your communities. By contrast, if you silo your successes, you'll only help one of your communities at a time. So there's a real opportunity there. Second, be sensitive to differences of resources and backgrounds. There's some significant divides in your community around Jewish background, religious beliefs and practices, political preferences, financial resources, and so on. Newcomers to your communities in particular say that they often have a hard time finding a niche for themselves because they don't share your local history and traditions, and it takes them a lot of time to learn. But at the end of the day, they're all Jews. The Talmud in Tractate Shavuot tells us that Kol Yisrael Arevim Zeh Bazeh, all of Israel is responsible for one another. We are collectively responsible for the inclusion and well-being of our neighbors, even if they practice their Judaism differently from us, even if they don't have the same resources we do, even if they don't have the same background as we do, and even if they hold different political views than we do, or come from a different place than we do. We're the people who argue about everything, but still take care of each other. And based on some of the commentary in respondent surveys about the community's strengths and weaknesses, we felt it was important to make this a recommendation, sort of a reminder that we are all responsible for each other. Third, supporting families in need. This doesn't require much explanation, and I've already described a lot of it. Your Jewish community, like most in the United States, is relatively affluent as a whole, but that does not mean there are no households that are struggling. Clearly there are. How best to support them may require that you raise awareness of the resources that are available to those who need them, particularly for young adults, families with children, and older adults, which are the populations that are often most at risk of significant financial need. And it might require allocation of new resources. Next, promoting active ties to the local community for newcomers. 2/3 of Jewish households in Delaware and the Brandywine Valley have been there for at least 10 years, including a little over 40% who have been there for 20 years or longer. You are not a community where there's a lot of population churn, which means that you have very strong social and familial networks. That is a tremendous strength in a lot of ways, but for newcomers, it's a double-edged sword because they can't always figure out where they fit into your community. Not knowing many people is one of the single biggest obstacles Jewish adults in your community cite for not being more actively involved in Jewish communal life. So you need to reach out to them and invite them in. We also noted that this is especially important for two distinct groups: young adults ages 18 to 44 who are in school, beginning their careers or starting their families, and also older adults, those 75 and older, who may have moved to the region to retire or to be closer to family. Nearly half of both of these groups are relative newcomers to your community, and they would benefit from greater assistance in forming their own ties to the local Jewish community. Next, although, as I've said, you've done pretty well in reaching out to interfaith families, we've recommended that you strengthen your efforts because they are such a large part of your community, and there is a big opportunity if your effort is even greater. The key, as I noted, is that we don't know who among the children of Jewish households, whether those with 2 Jewish parents or 1 Jewish and 1 non-Jewish parent, will identify as Jewish when they grow into adulthood. But the single greatest predictor is childhood involvement in Jewish schools, camps, youth groups, and other high-quality Jewish programs. This is obviously related to the next recommendation about investing in Jewish education, but particularly for interfaith families. If you want their children to grow up to be proud, active members of the Jewish community, you have to let those families know that they are welcome and valued. And a bit more on investing in Jewish education. We know that enrollment numbers have been depressed by COVID. That problem will eventually go away, God willing, but it's undoubtedly affected the trajectory of many kids' future Jewish identities, and we need to make sure that they're not falling behind. But it's not only about that. 40% of parents whose age-eligible children are not enrolled in Hebrew school said that the hours of the options available to them did not work with their schedules. 20% said that they couldn't find a Hebrew school option that was a good fit for their kids, leaving schedule aside. Other key factors included a lack of transportation, not belonging to a synagogue, and cost. So this recommendation is at least in part about exploring ways to help these families overcome these barriers, because it's important that every family seeking to provide Jewish education to their children has the opportunity to do so. Next, we suggested that you promote opportunities for volunteering in and with the Jewish community. Many of the members of your community are habitual volunteers, but they spend more time volunteering outside the Jewish community rather than within it. To be fair, that may be because the surrounding world tends to have greater needs in a lot of dimensions. Still, we know from other research that across the entire Jewish community, volunteering is an appealing way to get involved or to get more involved in Jewish life, even when the specific cause that you're volunteering for or the people who you're helping aren't Jewish. In essence, volunteering is a low-cost, low-barrier activity that is a great way of bringing together Jews of different backgrounds, different connections to the local community, both Jewish and general, different resources, different levels of religious observance, different interests, and even differences of politics. And finally, about addressing COVID-related anxiety. By the time we launched the survey, there were already high-quality COVID vaccines available, but data collection also took place during a wave that was driving up infections last spring, which led to increased anxiety about participation in communal life and communal spaces. It's nearly a year later now, and it seems to me that around the country in general, most people are back to something approaching a pre-pandemic normal, perhaps with a few additional precautions that they weren't taking in 2019. But your population is older than average, a factor that significantly increases risk from COVID. And there is a substantial number of people whose pre-existing health conditions also put them at elevated risk. That is simply the reality that we have to deal with for the foreseeable future. And COVID was specifically cited by 1 in 4 Jewish adults in your community as a barrier to participation in Jewish life. So even as you are easing restrictions to bring your people back to your communal spaces, you need to take steps to make your facilities safer for people to congregate indoors. You need to continue to hold events outdoors as weather permits. It's a little hard this time of year. You need to continue to make programs available online for those people who cannot yet safely join you as you return to communal spaces. You can't leave them behind. So these are just some of the findings from our study, the most comprehensive study ever of the Jewish community of Delaware and the Brandywine Valley. We sincerely hope that our work will be useful to all of you as you make plans for the future of your communities. And we are delighted now, as I mentioned at the very beginning, now that the hard work of the study is done, we can pass the proverbial baton to you for the hard work of using the data to better serve your communities. And as we do that, I just want to say thank you to all of the sponsors of the study, to the Jewish Federation of Delaware, and Seth, Hillary, Leslie, Richard, all of the committee members, all of the organizations and agencies who participated in this work, and of course, to the 1,065 people who filled out their surveys. None of this would have been possible without them. And so with that, I will turn things over for a few minutes, stop sharing my screen, and we'll get to your questions shortly. Thank you.
Okay, I hope everybody was appropriately stimulated and had lots of questions. I'd like to remind you that all the data you heard tonight and much, 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 much more will be in the public domain starting tomorrow. You will find the executive summary, the full report, and technical appendices on the Jewish Federation website. The full data file, again, will be available within a month. And now to the questions. We'll try to answer as many as time permits. And I encourage you to put your question into the question and answer feature, which is on the bottom of your screen. Okay, I will admit that some of these questions are difficult ones. We've only got a few, but we'll start. Someone asked about the size and participation rates of the Jewish community in comparison to the survey that was done in 1995.
Yeah, it's a great question. It's a little hard to compare for a couple of reasons. One is that the last study did not include the exact same geography. It did not include the Brandywine Valley at all, and it had very limited inclusion of Sussex County. The other is the methods for conducting this research have shifted tremendously in the last 30 years. We do a much better job of finding the people who are completely unaffiliated now than we ever did in the past. And so a lot of the old studies we know inflate participation rates, but we don't necessarily know by how much. So the last study, the one that was conducted in 1995, if I remember correctly, it estimated the population at 13,000 and change. But that was mostly Newcastle County, a little bit in Kent County, maybe a little bit in Sussex County, did not include the Brandywine Valley at all. We've estimated nearly double that population, but the boundaries have shifted a little bit. The most easily comparable difference between 1995 and now is that where it was clear that the vast majority of the population was in Newcastle County, and in particular around Wilmington, it is far more dispersed now than it was in the 1990s.
So there's another question that talked about a little bit about the actual survey process. And it was the some people got their survey by email, and might have filled them out wanting to make a statement about themselves. How do you keep the voluntary participants of this type representative of the whole, unlike those approached by the phone?
So it's a great question, and it's part of the difficulty of doing a study like this. We have to ensure that the people who complete the survey are representative of the entire Jewish community, not just the people who are most willing to take surveys or who are most interested in Jewish life. We do that in a couple of different ways, and I'll try to keep this as short as I can. The full methodology is described in the technical appendices, and it's very, very complicated. But we start by conceptually dividing the population into what we think of as the known Jewish community and the unknown Jewish community. The known Jewish community is anyone who happens to be on the radar of a Jewish organization. You don't have to be particularly active. You might be, but you might just, you might have participated in one event sometime 10, 15, 20 years ago. We know that nothing gets you off of Jewish organizations, membership, or mailing lists. And that's a way to help us identify the vast majority of Jews in any particular geographic location, just collecting those lists. And if you know who was on what list, you know that people who are on different kinds of lists have different probabilities of being able to, or being willing to do the survey. And we can account for that different willingness mathematically. We can make the people who tend to be less willing count for a little bit more so that they stand in for people like them who happened not to do the survey. And the folks who are more willing to do the survey, we can make them count for a little bit less so that they're not overrepresented. As for the folks who are unknown to the Jewish community, we have a number of techniques that we use to find them. The most common is called the distinctive Jewish names method, which is exactly as it sounds. There are about 150 last names that are so common in the American Jewish community that between 20 and 25% of all American Jews have one of these names. We've done a lot of research on these folks, and there are no statistically significant differences between them and the people who, like them, are not on any Jewish organization's list, but happen to have non-distinctive Jewish names, or Jewish names that do not appear on this list. So if we have a sense of how many of them there should be, and we do from some other tools that we use, then all we have to do is find enough of them, and they can stand in for all of the other folks who were not on any Jewish organization's list. And then just as we have to weight up certain respondents, make them count for a little bit more, and weight down some others so that they're not overrepresented in the sample, these folks, the unknown Jews, they're the hardest to reach, they're the hardest to convince to do the survey. And we have to weight their responses very, very heavily to make them stand in for all of those Jews who are completely off the radar of Jewish organizations. Now, in and among all of this, we use lots of different ways of contacting people to convince them to do the survey. The more invasive the contact method, typically the harder it is to get people to do the survey, and that's why you need to be more invasive. So the hope is that most people will do the survey after getting a letter or getting an email. Some people also need phone calls. As part of our process for weighting the data, we account for how people are contacted, and that plays into our algorithm that helps us ensure that we are accurately representing the full population of the Jewish community, whether they're affiliated or not. But it's very, very difficult to do.
Well, Matt, you did a good job of not only answering that question, but two others that were in the chat. Okay. There was a question, though, about the percent of people who were surveyed who responded. Is that something you can?
Yes. Again, this is a great question. Our response rate for the survey, if I'm remembering correctly, was about 31% in the representative sample. I know that doesn't sound like a very large number. 30 years ago, it was not uncommon to get 70, 80, 90%. For representative sample surveys these days, the standard in the industry is somewhere around 3 or 4%. We did 10 times that. As a means of comparison, the Pew National Study of 2020 got 17%, and they were dancing up and down the hallways of their offices being able to get that high a response rate. We did nearly double that. So it sounds like it's not a very good response rate. It's actually phenomenal in this day and age, and really all credit to the community. We just reached out to you. You filled out the surveys.
Matt, could you talk a little bit about cross-product research insights that will be available as part of the data?
Sure. So that's a term that has many different definitions depending on exactly what industry you're in. I assume that you're looking for a deeper breakdown. If you're looking at different segments of the population, where do they fit on this variable or that? So along those lines, there are two key items that will be tremendously useful to you. One is the report itself. Almost every table in the report breaks down whatever variable we're looking at by key segments of the population, by engagement group, by age, by geography. There's some other things in there as well. We also have in our comparison charts, this is one of the technical appendices, there's a link at the front of that appendix that will send you to our website at the Cohen Center, where you can download a series of Excel spreadsheets so that even variables that we didn't write about in the report for whatever reason, we still have them broken down across all of these key categories. And if you just need to look up one number, what does synagogue membership look like in this region? What does economic vulnerability look like for that age group? You just have to pull up the right spreadsheet and the number should be there for you.
Okay, there was a follow-up question from another individual, and I think you answered that as well, but I'll give you an opportunity to respond. And in that you indicated that our survey reflected a collection of several smaller communities that may have different characteristics and needs, but in total result on our community average. Can we easily look at the detailed data to focus on the needs of the smaller subset of communities that make up our larger community?
Yes, to the extent that those smaller communities are represented by the 5 geographic regions that I showed on the map, that is built into virtually every table in the report and in the comparison charts. We can't include zip code in the public use version of the data set, unfortunately, because it makes it too easy to identify individual respondents. However, for qualified researchers, aside from the public use version of the data set that we'll make available for anyone who wants to use it, we always also maintain a sort of restricted use data set so that if you're a qualified researcher with approval from a university or corporate institutional review board to conduct your own analyses, we can provide you with zip codes and you can classify them into your own geographic regions as well. You'd be able to do that analysis without our help.
And I'm very pleased to say that we do have amongst us those who would qualify for that kind of independent research. And we will be leaning on them to give us guidance along the way as we move forward. There was one question in the chat which had to do with the choice of geography that we chose to survey. And I'm going to let Russ answer this question because, Matt, you were given what we were going to survey. And Russ was involved in the decision of what to survey. So the question, Russ, went to why we did not include Maryland, parts of Maryland or New Jersey in our survey area.
Sure. And yes, Matt did the survey of what we told him to do the survey of. So great job with that, Matt. Look, from one basic standpoint, our federation is the state of Delaware. So everything in the state of Delaware was obviously included, but we immediately realized that there were a great deal of people who were participating in events at our federation, but also at the JCC, at Albert Einstein Academy, at our synagogues, at JFS, et cetera, that were living close over the border in Pennsylvania. So that's what started us on the path of looking at that particular area. After all, the traditional hub of our community, and indeed the building, is 15 minutes from the Pennsylvania border, in some places 10 minutes from the Pennsylvania border. We did not do something similar to answer this question directly about the areas in New Jersey and Maryland, because while certainly they can be close by some areas that are within our federation, they are not that close to areas that have been the traditional hub of our community. And we were therefore afraid that by including too much, we would wind up skewing our results. And so that's the reason why we included the just over the border Pennsylvania areas, but not areas in Maryland and New Jersey.
And Matt pointed out that for the person who asked the question, that Harford County was covered in the Baltimore study. And actually Brandeis did their study in 2019. So it's all in the family. Any other questions? Wait, let me look. Oh, what were the most dramatic changes or shifts that occurred between 1995 and now? I don't know that, Matt.
Yeah, again, it's tough to assess that, partly because of we're surveying a slightly different geography, partly because there wasn't really full coverage of even the state of Delaware in the last study, and partly because we're doing a better job now of covering people who are completely unaffiliated but happen to be Jewish than was ever possible 28 years ago. That makes comparisons over that much time very, very difficult to make. It's much easier. It would have been much easier to make comparisons if you'd had a 2010 study. And so when you go to do your 2032 study, it will be much, much easier to make comparisons to the 2022 study than it is today to make comparisons to 1995. I think the only thing we can say with absolute certainty comparing to 1995 is that your population it's bigger, and it's a lot, well, even that is a little bit tricky because you might have had unaffiliated people who weren't measured in certain parts of the state, but we can say with absolute certainty that your population is much more distributed across the geography than it was in 1995. Back then, 88% in Newcastle County, and more than half of that was in Wilmington. That is no longer the case.
Having served on that 1995 committee, I would absolutely agree with what you just said. Any other questions this evening? I think, let me look. Oh, one more. What would you say is the Jewish population of Kent County?
Oh boy.
I know we struggled with answering of how to present the data in clusters that were statistically relevant.
Yeah, off the top of my head, I'm not sure. I know it's not very large. So what did we say in the rest of Newcastle and Kent County combined, which we had to combine them because we didn't have enough cases to separate them. What was that? That was what proportion of the population? Anyone remember? Trying to pull it up quickly. Here we go. Chapter 2, geographic distribution. Jewish households, rest of Newcastle and Kent County, 17%. Jewish individuals, 18%. Most of that, if you looked at the map, was in sort of that strip of land that was part of Newcastle County between Wilmington and Newark. So it's very, very difficult to come up with an accurate estimate for for a relatively small geography where we had a few dozen respondents, like Kent County. Typically, we want 200 respondents in a particular area to be able to trust an estimate that we get there. So hard to say exactly from the study data. Off the top of my head, I would say probably no more than a couple thousand Jewish individuals. It might be more people than that living in Jewish households, but probably no more than a couple thousand Jewish individuals in Kent County.
There was one last question about our definition of the Brandywine Valley, and I'm going to refer you. It was an arbitrary definition based upon catchment area. And I'm going to refer you to the maps in the study because they will show you exactly what was included. Without any other questions in the queue, I'd like to thank everybody. One more. Was there any analysis done with the Jewish adjacent populations? That is not the same as the non-Jewish populations. I don't know that I understand the question.
Yeah, I'm not sure that I do either. We have, if you look at the details in the report, we've defined people as Jewish and not Jewish. Those are the folks where the non-Jews are the folks who live in Jewish households, have Jewish families, they're part of the Jewish community, they're not themselves Jewish. There are other people who took the survey who told us that they were Jewish, but when we started looking at their data, they told us they weren't born Jewish, they weren't raised Jewish, they didn't have Jewish parents, they never converted. And when we look closer at their data, they don't look like Jews. Those might be the folks who you're referring to as Jewish adjacent. We always get some of them in every study. And there are two main categories that they fall into. One that we keep and the other that we drop from the analysis. The ones that we keep are the people who, when we ask them a follow-up question, how is it that you came to see yourself as Jewish? They tell us, I married a Jew, I have Jewish children, I have a Jewish family. Those cases we keep because if their Jewish spouse or partner had done the survey, that would have been fine. This is a household survey. It is a survey of Jewish households. And we allow the non-Jewish spouses to complete the survey. Sometimes they're willing and their Jewish spouses aren't. We want the data. We want to be as complete as possible. We need to get them into the survey. We keep those. They're still part of Jewish households, even if they're not Jewish themselves. The ones that we drop, the quote that I always use comes from a survey I ran in 2010. We asked these people who aren't Jewish, they weren't raised, they weren't born Jewish, they don't have Jewish parents, they never converted. How is it that you came to see yourself as Jewish? And this one respondent wrote, I was grafted in through my Lord and Savior, Jesus Christ. For people like that, I always say, if Jesus wants to come back and take our survey, he was a nice Jewish boy, we can count him. But this person does not count. You cannot consider yourself a Jew because of someone else's Jewish identity. So those we drop. Those are the two biggest categories of what I think of as Jewish adjacent. They pop up in the literature in Jewish history under various names, Erev Rav, Theosebes. There's been a lot of research on these populations, but we just drop them. They screen out of the data usually. And if they do end up screening in, we end up dropping them pretty quickly because we don't consider them Jewish. The communities that we're working for do not consider them Jewish. And so they should not be included in the analysis.
Okay, on that note, I think we're going to conclude for the evening. I thank all of you for your participation, for being involved and caring. And I look forward to the wonderful work that will be done as a follow-up to the survey because the work is just beginning. Have a good evening. And remember, check the Federation website tomorrow and you will see everything you wanted to know about the data. Good night and thank you.